I want to tell you about my patient who saw me a couple of years ago. I'm going to call her Mary. Mary had, she was in her 60s. She had had joint pains, particularly in her knees, for a long time, and she had already been told by her orthopedist that she needed a knee replacement surgery because her arthritis was very advanced. But she did not want to have surgery. She did not want that hardware in her leg. So she came to see me and said, "Oh, I give up. I'm in so much pain. I'm getting fatter and fatter because I can't walk, and I can't walk because my knee hurts. So just refer me to the orthopedist." So I said, "All right, Mary, I will put a referral in for you to see the orthopedist." And then I said, "Would you like to try something that may be helpful and maybe you might not even have to have the surgery?" She had been my patient for a number of years now. She was a diabetic, so she kind of already knew where I was going with this. She said, "Dr. Song, I know exactly what you're going to tell me. You're going to tell me to change my diet. How's that going to help me with my knee arthritis? It's bone on bone." So I told her, what we see on x-ray, the relationship of that tibia and the femur, that narrowing of that joint, that eroding away of that joint, yes, that's what we see on the x-ray. We see the big picture. But what we cannot see on the x-ray is the microscopic picture. We cannot see all the immune cells that are there to clean up the debris because your cartilage cells are being destroyed. They can't repair themselves. We can't see all the little chemical messengers. You know why when we give you a steroid injection into your joint, it helps the pain? Temporarily. But you know why it helps? Because it's paralyzing those immune cells. It's paralyzing all those messengers. And so I talked to her about how she can adopt a diet that's going to calm that immune system down and that's going to help that cartilage to repair. Well, she had nothing to lose. So she said, "I'll try it." Fast forward 4 months, she came back to see me. She was all smiles. She sat down and she said, "Dr. Song, I'm walking 2 miles a day and I don't have any pain." Now her culture, she eats white rice and chicken or white rice and fish every day. And so she had been eating brown rice. Now remember, she's a diabetic, so I told her even with brown rice, you can't eat a whole, 2-cup bowl. So she was having a couple of tablespoons of it at the meal and lots of vegetables. She was making lentil soup and putting veggies in it and having a great time with it. She was feeling fantastic. And so she said her family kept telling her, "Well, you need to have some of this chicken. Eat it." And she said, No, I told Dr. Song I wasn't going to eat any of it for the next few months. She said her son told her, "Well, why aren't you seeing the orthopedic surgeon? You need that knee replacement." She said, "Why should I? Because I can walk." So we'll leave that story there. It's a great illustration of how your diet can impact inflammation in your body. Now, we talked about the gut microbiome at the last hour. Those bacteria communicate with nerves in the GI tract. They communicate with pain signalers throughout your body. They communicate with your immune system. They communicate with inflammatory cytokines, which are chemical messengers. And so through myriad of ways, they can modulate pain. Now, there isn't just one type of fiber. 30, 40 years ago, I used to think fiber was this, monolithic entity, whatever. There are many different kinds of fibers in plants. You get your insoluble fibers, which go through your GI tract pretty much unchanged, almost unchanged. And you get these from things like brown rice and whole wheat and a lot of vegetables. Insoluble fibers keep your GI tract regular, help your stool to bulk up, and they also attract beneficial bacteria to your colon. But you also have soluble fibers of many different kinds, many different degrees of solubility and resistant starches. You get soluble fibers from oats and apples and eggplants and beans and all throughout plants. And these actually form short-chain fatty acids when the fiber-eating bacteria come and digest them and ferment them. you get short-chain fatty acids. And we're now learning more about how important those short-chain fatty acids are in modulating inflammation, in speeding up your metabolism actually, and reducing your risk for diabetes and obesity. So, we have studies actually showing that plant-based diets help reduce the occurrence of migraine headaches. You know, some of the people that are the most resistant to advice regarding changing their diet are people who are already vegetarians. I could eat ramen noodles and put cheese on it, break an egg on it, and, you know, say I'm a vegetarian. So people who are vegetarian, who don't eat meat, but they eat dairy products regularly, and they eat white rice regularly or white breads regularly, these are some of the most surprised people when they adopt a whole food plant-based diet. So, you know, high fiber, you know, staying away from the processed grains and eating a lot more colors, making that effort to eat those green things, those purple things, those red things. Those are the people that are the most surprised when they see that their migraines drastically improve, or their joint pains drastically improve, their fibromyalgia, their fatigue dramatically improves. I can't stress enough the importance of eating enough colors, including the blue-purple pigments, the anthocyanins that you get from berries and beets. Every day you should eat something purple, and you should eat something green every day. I want to say something about the greens, though. So I learned this a couple of years ago, that chlorophyll, the pigment in plants that gives them that green color, plants photosynthesize. They make energy directly from light because of chlorophyll. Well, you and I, we really can't really make a whole lot of energy the way plants do directly from sunlight. We need to eat our calories to make that energy. But the sunlight still activates the chlorophyll that you've ingested. After you eat your big salad or your cooked greens, the chlorophyll that is swimming around in the capillaries just under your skin, if you go outside and you expose your arms and legs to the sun, the sunlight activates that chlorophyll, and that activated chlorophyll will flip ubiquinone, which is oxidized, back into the unoxidized ubiquinol. These are in the mitochondria, the energy-forming organelles in your cells. So this whole process helps to propel energy production in your cells, helps your cells to work better. So eat your greens and then get out in the sun and get your sunshine and fresh air. And I want to end on fresh air. Fresh air is so important. The lungs are the way we get rid of an important waste product, carbon dioxide. Did you know that wearing a mask on your face for hours at a time will, this is true of all kinds of masks, both surgical masks as well as N95 masks and the KN95 masks. If you wear a mask, you are slightly raising the amount of carbon dioxide in your blood and slightly making your blood a little bit more acidic. I was looking at some studies on this during the pandemic. Children who were born during the pandemic have lower IQs. This is not everyone, of course. There's an astounding 28% rise in stillbirths during the pandemic. And some researchers believe that it is due to pregnant ladies wearing a mask at work for an 8-hour shift, 10-hour shift, 12-hour shift, because in order for the fetus to clear its carbon dioxide waste into the mother's circulation through the placenta, the mother's pH needs to be higher. The blood needs to be less acidic, have less carbon dioxide in her blood in order for the fetal clearance of carbon dioxide to be efficient. So you can imagine if half the day mom's carbon dioxide level is just a little bit higher than it should be, that fetus is going to have a harder time clearing its waste. And that's just one of the effects. I saw patients who were having headaches, who thought they were dying from cancer, who were depressed, and it all had to do with wearing that mask. So Do masks have a legitimate use? Yes, they do. If you're cleaning out your attic and you're kicking up a bunch of dust, wear that mask. It can help. If you're a surgeon and you're standing a foot away, your mouth is a foot away from a sterile surgical field, by all means, wear a mask because it can stop the drop of that spittle onto the space immediately below you. But a large study published last year in the Cochrane Review that looked at 78 randomized controlled trials of masking and spread of infectious disease found zero impact. This was such big news, even National Public Radio carried the story, haha. Yeah, they really didn't help the way they were being used. Don't get me wrong, N95 masks, if used the way they were designed to be used for a few minutes in a hospital negative pressure room where you've isolated a TB patient, they are very effective if used that way. But they weren't, of course, designed to be worn for 8 hours at a time or 10 hours at a time. And also, lastly, if you are harboring some disease-producing bugs in your nasal passages, there's something called the Fogan effect that's been published about. If you wear a mask, you are going to be more likely to inhale those bugs deeper down into your lower respiratory tract. So, colorful diet, high-fiber diet, sunshine, fresh air, get out there and move. You'll feel better, you'll have more energy, and hopefully be in less pain. Thank you.